Hi, this is Erin Hurley. I am a physician and coach, and I am here today with fellow physician coach, Dr. Joanne Sotelo. And today we're going to be talking about a sobering statistic or sobering reality that is in the medical career these days, that of physician suicide. So, Joanne, you are a physician, a psychiatrist, and a coach. And so help us understand a little bit about what's going on with the rates of suicide or the suicide impact on physicians in the US.
Yes, thank you, Erin. Yes, so we know that physicians in general have been struggling more with depression, anxiety, unfortunately, suicide ideation and suicide completion for years. And unfortunately, in the last year since COVID, these numbers have gone up. The last statistics say that more than one physician, it's almost like 400 physicians a year. So it's like, if you think about it, right? Like if we follow that,
400 a year?
yeah, so it's one per day, more than one per day. So imagine there's might be a physician today thinking about suicide and maybe even attempting. So it is definitely something real that we need to talk about, and we need to be part of the change.
Yeah. One of the areas when I've looked at this, because I do some comparisons about what's the difference between how women do medicine and how men do medicine, because we do practice medicine differently. And then when you have all those cumulative barriers to success. And when I looked at the rates between women and men, actually women physicians are about as likely to complete suicide than the men are. And in the regular lay public, that's not the case, that women might have more attempts, but they're not as successful. And so that's where, as we talk today about what are the things that we can do if physicians are maybe more likely to complete suicide because of their expertise, knowledge, their just their personality types, it's that much more imperative that we act now, because we may not get another chance if it's a physician contemplating suicide, which I think is much different than the general public.
Yes, and it is heartbreaking to hear people that we look really good from the outside, and there is so much suffering in silence that we are doing, because we learn, we're programmed to just say, "Oh, I'm fine. I don't need help." I say that fine is the four-letter word that starts with an F that we struggle with
Mhm.
as physicians. So it's so important, and think about it for yourself, right? As strong, especially as women, we have so many roles that we're programmed to just be the lone ranger, just do it all by ourselves, and we can. And the analogy I use is how we're very resilient, but it can go against us, right? It's like that rubber band that we keep on stretching and stretching, and it starts losing form, it starts losing strength, but it keeps on going. But we're not
Until it breaks, until
it
it no longer can
it
handle that.
can break,
Mhm.
right? And it does break, and that's how we have to think about it. It's
Mhm.
so important. So it's, first of all, it's that awareness that we are all at risk. A lot of times
Mhm.
I'm trying to help someone, whether it's in my psychiatry practice or in my coaching, which is where I help most of the women physicians. And they tell me, yes, I'm struggling with this and I don't have time for myself and I'm so exhausted, but I'm fine. No, I don't need help. No, I'm not horribly depressed. And then we stop there. And one of the most important things is to know that that's exactly when we need to start taking action. We all need to start taking action right now, because we don't want to wait to that point. Of course, if it gets to that point, yes. Oops, sorry, my cup, talking about needing help. And and the microphone's getting in the way. We need to do something, and we need to start building our reserves and recognize that we are all very vulnerable to it, to
Mhm.
depression,
Yeah.
anxiety, burnout, substance abuse, and of course then the worst outcome, the lethal outcome, which is suicide.
Mhm.
So we need to keep all of that in mind.
Yeah. One of the other things that, so I sit on my medical society board. I'm also on a statewide executive committee that was put in place after 3 physician suicides in Eugene, Oregon, just an hour and a half south of here. And then the action of that medical society turned into a statewide network to provide free confidential counseling with access within 72 hours. It started out just for physicians, and now it's for all licensed healthcare practitioners and nurses. And what I've found as a physician coach and someone who puts on wellness retreats and activities for healthcare providers, especially a few years ago, and it's getting a little bit more common now, but they're afraid to seek professional counseling because they're worried about what that's going to do when they go to credential, when they're asked questions on their licensing and for the medical board. Have you sought counseling? Have you sought mental health? And there's actually a movement going on where they're trying to get some of those questions taken off so that there's not this fear and even paranoia to seek the help that's going to help you keep practicing medicine and maybe help change that course for you if you're feeling depressed, anxious, and even suicidal. And I'm excited that there's been some change. And I'm also excited that, as I've learned over the last 6 years, that coaching, it's not therapeutic, but it also can help people. That's what got me out of burnout, was working with a coach. So knowing that, if you're not going to choose one route, maybe there's another route for you. And I think the other thing you said a moment ago was about that pause to choose yourself. And Sherry, we were talking earlier today, and there was a really poignant story that came up for you today about that. And I would love for you to share it.
Yes, right, like reading a letter from a fellow physician who passed away, and in some of her notes, there was a wish of, I am going to choose me, like I'm going to choose me without guilt, because that's the other gigantic thing that we deal with, right? Like we're caretakers, we do so many things for so many other people, and we don't treat ourselves with that same love and compassion. And or when we do think of, there's something I need, or I want to invest on myself, I want to invest in my growing, that then there's a lot of guilt of, oh, I shouldn't. So, and then we make the assumption that we're going to have time, and then we have that arrival fallacy of, when the kids are older, when I have a partner, when I go on vacation, when I go
Then
part-time.
I'll choose me.
And that's how sad, right? Like we need to choose, right? Like have that phrase, I'm going to choose me right now, whether it's a big step or a small step. And how important is to have that awareness that if we don't, how can we give others when we're empty inside, or we're struggling in silence, or we don't have enough to give back? So that's, a beautiful place to be.
Yeah.
And
So it sounds like, say that again.
everyone around us benefits when we're doing better, right? It's that ripple effect. And
Yeah.
we tend to think about it backwards. Like we have to help the others first.
Right. And I think the other piece is that I always look at, the way to make change, first you have to have awareness, and then you can make the change. And it sounds like this physician had the awareness that she needed to start choosing her, which was probably different than she'd done, and not feel guilty about it. But the other thing that, who knows, did she ever have that moment where she did choose herself? Because one of the things I find so frequently with the women that I work with in medicine, they might reach out to me, can we go out for coffee, knowing that I do coaching and I help with wellness? We go out for coffee, and you know how long it takes them from that time where we had coffee and they spilled all the issues falling apart in their lives, and before they took action and maybe joined one of my group coaching courses or showed up to a workshop or followed up, months and sometimes years. And what I can say is, I had an interaction that happened earlier this week. I received an email, and it was somebody saying, I've been trying to tell myself I don't need a coach. If I saw one, I didn't think I was going to like what I heard. Right. And so I put it off for a year. When I look at how long this person has known about me and what I do to support healthcare providers through the coaching, and it's been about a year. And from the time that person said, hey, Do you have time to help? Less than 48 hours. And I was on a call with that person talking about things in real time. You can't even get a therapy, it took me 2 days when I was doing some research for a friend to find out about openings to even get a note back to say, sorry, we're full. Try somewhere else. So it's just one of those things where even if we say, I'm going to pick me, then let's shrink the amount of time that it takes to take the action behind that awareness and desire. So we're not waiting maybe for some people too long because they didn't choose themselves.
And in the meantime, I get a lot of questions as a psychiatrist and as a coach of what can we do, right?
Mm-hmm.
And I say the first thing always, like we just both said, the first thing is always awareness. And
Mm-hmm.
then I say, right, like if we think of ABCs, right, like it's awareness, and then this is kind of like a long one. It's like back to the brain basics of what keeps our brain healthier. And there's simple
Mm-hmm.
things that we need to take accountability, right? And you and I talk about this all the time, of sleep,
Mm-hmm.
right? Nutrition and movement, right? Like and then some mindfulness that we both love in terms of journaling and or yoga, or even if it's just
Meditation.
breath
Mm-hmm.
work. Yeah. So those things, because I hear so much of that. I'm exhausted, I'm fatigued, and then it's, what time are you going to bed? And what are you doing at nighttime? We can have one of our talks be just about sleep. What are
Yeah.
you doing at nighttime in that in your routine, and what are your distractions? And because you're tired and you feel like you don't have time, you might just grab something on your way home. And what are you eating? And then we're so tired we don't move, and then it keeps us in that bad cycle. And then the
Yeah.
thing that we don't always think about, but how important it is connection, right?
Mm-hmm. Yeah.
Connection, not just with other people, but within ourselves. The right
Mm-hmm.
that choose me, that connection with your core of the essence of who you are, and giving yourself that self-care. And it sounds simplistic, but that is the base that we can all start working on. And for sure, you're going to start feeling at least a little bit better. So that's something
Mm-hmm.
that we can do regardless of what's going on, regardless of
Mm-hmm.
where you're working, what's going on in your marriage, your
Mm-hmm.
kids. Those are
We
things
have
that we take
choice.
ability for.
Yeah. And then there's a ripple effect. And so for anybody who's follows things like compound interest, right? You can add, if you add enough pennies in the bank every day, those pennies of investment can add up to $1 million if you do it consistent. And so for me, 12 minutes of meditation most days over the last 5 years, I have saved hundreds of hours of arguments and poor decisions because I made that tiny little investment every day. And so you don't have to do something big. And then there's that compounding effect when you do it consistently. And then also that ripple effect. I have one provider that I'm working with, and she started a 5-minute walk at lunch. It is so hard to get providers away from their screens and do one more thing over lunch. No, 5 minutes. Give yourself a 5-minute break and go for a walk. Don't mindlessly scroll on your phone. Do something intentional. Then they started inviting their colleagues. So now they're max packing 5 minutes. They're getting outside in nature. They're shutting down from screen time. They are connecting with each other when she has guests on the walk and with herself when she does not. She's moving her body. So, shifting energy. If you had a really hard patient, now you're moving your body. And you know what happens from that 5-minute tiny little investment in her afternoon? Do you know how much better her interactions are with her colleagues that she's now connecting with for those 5 minutes? And she's role modeling a very healthy way that you can treat yourself to a little me time every lunch.
Yeah.
Really
Oh, that's
powerful.
beautiful. I love that. And I love the ripple effect. I'm all about role modeling and the ripple effect. Because again,
Yeah.
if we take it back to our mission and why we're here and why we're talking to you all, and in thinking we don't have to wait until it's fully broken to start talking
Mm.
about it, start asking or offering help. Right. So if you're feeling well, if you're listening to us and then saying like, oh, I'm fine, I don't need all of that. then think about it for someone else, because it's not just
Mhm.
about us, it's about how then we can help other people, and the ripple effect, and right, and if we have
Absolutely.
tools that we can share, and definitely we all need this, right? Like, this is not just particular to women physicians. We all need this connection, and better accountability for our own health, and our right,
Yeah.
in all aspects, our mental, emotional, physical, spiritual.
Yeah. And when you, at the beginning of this call, you talked about kind of that facade, that mask we put on. I'm fine, right? I can't let people know that there's a crack in my armor. And it's exhausting to have that facade. And when we choose not to share any of the things that are going on with us, and the person sitting in the office right next to you is having the same things, when I connect women in groups and we start sharing some of the painful things about being a physician or a healthcare provider, and they're like, oh,
Mhm.
things that I coach other women are, I thought were errand problems. They're not, they're so widespread. And so you realize, and so even the discussion about suicide, right? If we can't talk about suicide, maybe it's not us that's feeling suicidal. But if we talk about, hey, I watched this thing from these two physician coaches and they talked about physician suicide and we're at risk. Did you know that? What are we going to do differently to decrease that? And maybe they didn't share it with you, but maybe it's them that needed this message. And so the other thing that we can do is, how can we have this ripple effect about having this one tiny message here? How can we share that so that the people who need this message, if it's not you, you might be the person who hands it out to someone else, or who brings it up when someone else was too afraid to, or too ashamed to bring it up? And can we normalize talking about not
Mhm.
just the perfect, social media perfect things in our lives, but the hard stuff and the difficulties as a healthcare provider?
Yeah, that's one of the things I love about group coaching, right? Because at the beginning, it's there's right, especially if I have a group of physicians, and it's like, no, 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 you cannot talk about that. Or something else that happens is, you think that your problems are not big enough or important enough. Like, oh, I shouldn't complain about that because someone else has it worse. And I always say,
Mhm.
like, your pain is your pain. It doesn't matter, right? Like, it's yours, and to validate it. And when we are vulnerable in a group, we give permission to someone else to be vulnerable themselves, even if it's not out loud, even if it's just in the permission to yourself to feel it, right? Like, we have to feel it, and
Mhm.
know.
And you may vocalize for someone who's not comfortable bringing it up, but by bringing it up, they might go, "Oh, I'm not alone," and they didn't even need to talk about it. And yeah, so powerful. Yeah.
Yeah, no, this is definitely an important conversation to keep on having. And in the meantime, and it's the beginning of the year, right? So it's symbolically too that we have to think of, what do I want to feel different this year? What do I want to
Mhm.
experience different this year? Right. And to take care of our mental and emotional health, obviously I'm biased because it's what I've been doing for more than 20 years. It's so important, right? And then it's our foundation, and everything else gets better there. So definitely
Yeah.
something to keep on talking about.
Yeah. So as we wrap up, we talked about sharing some resources and some tips.
Yeah. So one thing I do want to say before we finish is, again, we've been talking about mental health, and
Mhm.
Erin and I, we both do coaching, and there's so much that we can do to help, kind of in the prevention and the awareness piece. And also, if you feel like it's affecting your functioning, where you feel like you have to crank yourself up every day, if you're feeling hopeless, if you're, the anxiety, it's horrible. Remember, we're here as coaches to give, and we are physicians, but we're giving you information to help. We're not showing up as in giving medical advice. So if it's to that point, please don't hesitate to contact your primary care doctor or psychiatrist or psychotherapist. And of course, if it's severe enough that you're having horrible hopelessness, thoughts about death, thoughts about suicide, there's, again, call those people. And there's also the National Suicide hotline that now has a 3 numbers, 988. If you did not know that, they have, this is something, thank goodness, in the mental health world that was created. So 988, we're going to write it in the notes as well, so you have it. So again, don't hesitate to seek that help. But bringing it back to what we can do today, I love the choose me that we've been talking about. So I would love to hear it from you, Erin. Like, if right, like if you're choosing you today, what would you do? Like, give us one thing.
Yeah. And I like to simplify things. As physicians, we always raise the bar so high. We're kind of competitive and perfectionistic. And I say, lower that bar. And so when I choose myself, when I'm filling up my water container, and I have a slow filter on my refrigerator, and it always, so instead of getting frustrated, I use that time to close my eyes and take a deep breath. Or when I'm washing my hands, a little mini mantra or meditation. And we all have time for that. So is there, what do you like to do to lower the bar, Joanne, and make something super easy where you can choose, when you're doing your choose me moments each day?
Oh, I love that, Erin. So I am a journaler. So I tell everyone about journaling, and everyone is like, no, I'm not going to journal. So I said, just write down. It'll take you literally 10 to 15 seconds. Write down one thing that you're grateful for. To me, it's very powerful, and it's very grounding. Like, it's the pause that you have to take to do that, and the intention and the energy, and of course what you write. So it's just like a beautiful package, and it'll take you less than a minute to do all of that. So that's my choose me for today.
Yeah. And I love that as you talk about the ripple effect, talk about the science, you are training your reticular activating system to go against the negativity bias and look for the positives. And imagine the compound effect that's had on you when you have a rough day. But because you found gratitude in every day, no matter what, you're better at it. You can find it even during those hard times because you've chosen that. And I see that, as I've gotten to know you, not everybody's going to know what you're going through because you have chosen those practices that are going to lift you up on those days when you're not feeling like it, because you've invested and you've said, I'm going to choose me today, not just starting today, but for quite some time now. I love that. So, all right. Well, thank you so much for checking in today, Joanne. It was so great to spend some time with you. And our plan is to be here same time next week.
Yeah. So whatever questions you have, things that you want to talk to or bring to us live, we're going to be here weekly to share our wisdom with you all. So thank you for listening.
Yeah. And what we would like for you to do, so don't just listen, right? Now you're aware. We want you to do something to choose you. So maybe you can put in the comments, what thing are you going to do to choose you today? And something that maybe you'll do tomorrow and the next day. Put it in the comments. We'd love to see it. Thanks so much.
Love you all. See you later. Bye.